The two-person infusion check is a highly recommended practice for all infusions initiated by the spine, transplant, neurosurgery, cardiac, and regional teams. It also has application for all infusions initiated by anesthesia providers in the operating room and for infusion checks at the patient bedside. In this video, we will demonstrate how to perform the two-person infusion check. The two-person infusion check involves checking three elements: the syringe, the pump, and the tubing, or SPT squared for short. The squared means it is checked by two people. To check the syringe, we read the patient name and MR number, as well as the drug name and concentration, to be sure we've picked up the right drug for the right patient. To check the pump, we check three elements to confirm we have the right programming and thus proper delivery of medication to the patient. The syringe drug and concentration matches exactly what's programmed in the pump. The weight matches the dose weight in Epic, and the dose is within normal range. Finally, we check the tubing. We make sure it is unclamped and attached to the infusate line. Now that we've reviewed the checklist, let's practice it. Pick up your patient's medications at the pharmacy window. Make sure to read each syringe and confirm you have the right name, MR number, drug, and concentration. After priming the tubing and labeling the syringes, go ahead and program the pump. Place an infusion checked label on the pump as a visual that the pumps are ready to be double-checked by the second anesthesia provider. Then, inform your attending that your infusions are ready for a double check.
Hi, Dr. Quinlan. Could you check my infusions? I'll go and see the patient.
Good morning, sure. All right, I'll use the SPT squared tool. First, I'll check in Epic and confirm the patient's name is Abigail Doe, MR is 4440444, and the dose weight is 20.2 kilos. Next, I'll take a look at the syringe. I have Abigail Doe, MRN 4440444. The medication is phenylephrine, and the concentration is 20 mics per ml. Next, I'll take a look at the pump. The pump is programmed for phenylephrine, concentration 20 mics per ml. The dose weight is 20.2 kilos, which matches Epic. The dose is set to 0.1 mics per kilo per minute, which is appropriate. Next, we'll take a look at the tubing, verifying that it's primed, unclamped, and connected in two locations, to the quad connector and the infusion tubing. This looks great. I'll move the infusion check sticker.
As you can see, she ran through all three of the elements on the checklist: SPT, syringe, pump, tubing. She will proceed in checking all the remaining infusions in this manner. The check should ideally be performed before the patient is brought back to the room. In the case of the solo provider, consider reaching out to the PACU attending, or if that is not possible, the check can be performed with the OR circulator nurse. In that case, it will need to be performed as a side-by-side check with the nurse at the computer and the anesthesia provider at the pump. Propofol infusions can be checked by simply checking the pump programming and tubing. Make sure the right drug, dose, and weight have been programmed in the pump, or you can confirm that the infusion rate in Epic matches the infusion rate on the pump. It's important to make sure that the tubing is connected to the infusate line, either to the side port of the IV tubing or connected to the side port via quad connector and not hanging on the pool.
Infusion errors can occur anytime we change the pump settings, so be sure to double check any programming adjustments you make. When replacing a syringe, proceed with the complete infusion check, making sure your original pump settings have been restored.
Thanks for watching this video. The two-person infusion check will help safeguard against infusion errors in the operating room and ensure that we are reliably providing safe delivery of our infusion medications to our patients.